So for today's video, I'm going to discuss to you the non-narcotic analgesics, specifically non-steroidal anti-inflammatory drugs. This is my case report. During the treatment with NSAID, your patient complains of increasing pain. Discuss how you will address the situation. Describe any assessment you might complete. So here are the case facts. During the treatment with NSAID, your patient complains of increasing pain. So what is the mechanism of pain? When the cell is damaged caused by any stimulus, it releases chemicals called arachidonic acid. And enzymes, namely COX-1 and COX-2, converts arachidonic acid into prostaglandins, which are later on converted to many different chemicals, which causes pain, fever, inflammation, and etc. Non-steroidal anti-inflammatory drugs, also known as NSAIDs, are another type of non-narcotic analgesics, which are commonly used by adults on a daily basis. So it is divided in therapeutic classes, which is a property of analgesics, which is reduce pain, antipyretic, reduce fever, anti-inflammatory, which reduce swelling and inflammation. So the drug action, NSAIDs are working by inhibiting the production of certain chemicals which cause pain. Take aspirin, for example. Aspirin binds with the active site of both COX-1 and COX-2 and later on decrease its size. By the time the arachidonic acid binds with the COX-1 and COX-2, it inhibits the binding of COX-1 and COX-2 with arachidonic acid, which means it inhibits the production of prostaglandins. For the dosage of the NSAID medication that are taken, depending on the NSAID and the condition treated, some NSAID may work for a few hours, while others may take a few weeks or two before most benefits are achieved. So every 4 hours to 6 hours are prescribed. For osteoarthritis and rheumatoid arthritis that need long-term treatment, only once or twice a day are needed. But also to remember, when taking any NSAID, we must check the manufacturer's direction for using the NSAIDs. So the common side effects of taking an NSAIDs are gas, feeling bloated, heartburn, stomach pain, nausea, vomiting, diarrhea, or constipation. So what are the common adverse reactions of some NSAIDs? Selected NSAID can cause, like celecoxib, can cause dyspepsia, ibuprofen, which causes headache, dizziness, somnolence, nausea, dyspepsia, gastrointestinal pain, and rash. Naproxen causes headache, vertigo, dizziness, somnolence, insomnia, nausea, dyspepsia, gastrointestinal pain, and rash. And also refocoxib causes headache, dizziness, somnolence, insomnia, dyspepsia, hemoptysis, and rash. Next is we need to address the situation. First is we need to know our patient. We need to acknowledge that he is in pain. It is hard for our patient to know that he is currently taking medication to reduce pain, but instead it increases it. And also we need to gather the history of any pain or medication use for the pre-existing condition that he or she has. We need to know the medication. All the medication that he is currently taking, its dose, the duration, and what he or she is taking it for. We need to use a multimodal approach to pain management. We need to acknowledge the possibility of outside force, probable if not pharmacological reasons, other treatments and procedures that he is undergoing. Next is we need to be attentive to any pain management issues. We need to acknowledge all the objective and subjective data in relation to the pain that he is currently in. Now for the nursing assessment, the first thing we need to know is the location. We may ask the patient, where is your discomfort? Next is the quality. Tell me what your discomfort feels like. Next is the intensity. On a scale of 0 to 10, 0 representing no pain and 10 representing the worst pain possible. How would you rate the degree of your discomfort having right now? Next is the pattern. In the time of onset, we may ask, when did or does the pain start or start to occur? Next is the duration. How long have you had it, or how long does it usually last? Next is the consistency. Do you have a pain-free period before, during, or after your medication? When and for how long? Next is the associated symptoms. Do you have any symptoms before, during, or after your pain? Next is effects on activities of daily living. How does the pain affect your daily life? Next is past pain experiences. Tell me about the past pain experiences you have had and what was done to relieve the pain. Next is the meaning of pain. What does having this pain mean to you? Does it signal something about the future or past? What worries or scares you the most about your pain? Coping resources. What do you usually do to help you deal with the pain? And affective response. How does the pain make you feel? Anxious, depressed, tired, or bothersome?